Hi, everybody. This is Debbie Dunn, GAPNA National President, and I'm so happy to have you with us today. We're doing a little series called Facing Forward, and this is really about looking forward into this COVID healthcare crisis as it's happening and taking up some timely topics in care of older adults. So I've asked experts from our GAPNA membership to be with us and talk with us about some of these very important issues that are being experienced and that we're all trying to deal with and take care of people as we go through the COVID crisis. So our first guest is here today to talk to us about older adult mental health broadly and then within this COVID crisis. And I'd like to welcome Dr. George Peraza-Smith. Welcome, George.
Thank you. Thank you for having me.
George is a member of GAPNA, and he is the gerontologic nurse practitioner. He's also president of the Gerontologic Nursing Certification Commission. George works at South University. He's the graduate chair for APRN and DNP online programs. He has his own clinical practice in a skilled nursing care facility with Optum. George is a fellow of the American Association of Nurse Practitioners. He is president of the Florida Nurses Association, and he's been an active member of GAPNA for many years and served on the board at the national level. He also is very active in our Geropsych Special Interest Group in GAPNA. So again, welcome, George.
Thank you.
I just want to start off by having you tell us a little bit about the context of mental health needs of older adults.
Right. So, this is one of my favorite topics to talk about. And so I appreciate the opportunity to talk to you about mental health in older adults. And I think one of the things, especially during these trying times, I think we have additional challenges around mental health or mental health needs of older adults. I like to think of our older adults in this regard in two cohorts. One cohort is the majorities, 85 to 90% of older adults are going to be doing just fine. They have social supports, their needs are getting met, they have family members, connections, and they're connected to their community, and they will do fine. And then there's the 10 to 15% that do not have those social supports, who are disconnected from their community, whether that's in a long-term care or assisted living, or even from their home, as we try to age in place and have more and more people living in their home. And so I think that those are the individuals, especially during this crisis time, is really the ones that we need to pay attention to, and to be sure that we're connecting with them, getting in touch with them, and being able to help them meet their first basic needs. Maslow's hierarchy of needs, we need to really focus on their basic needs in order for them to be able to achieve their psychological well-being and needs as well. And then you add into this crisis, you add mental health problems or conditions, then we know that that's just going to potentiate the isolation, the desperation, the need of older adults that don't have all those supports that one would need. We know that 1 in 4 or 1 out of 4 older adults, and there's some statistics that say 1 out of 4, 1 out of 5 older adults in their lifetime will experience some mental condition, whether that's a diagnosis or whether that's just stress or stress-related illnesses and mental health, and that the majority of those are depression and anxiety, and we see that in primary care often, is depression and anxiety, both or each by themselves. But we're also seeing older adults live longer with diseases that before they didn't live past middle age, and that's schizophrenia and bipolar disorder. And so we're starting to see more and more older adults at that stage of their life with these chronic conditions as well.
George, that's really interesting. I'm just wondering now, as APRNs, as nurse practitioners, Do you think that we should be on the lookout for exacerbations in these mental health conditions when older adults are known to have them?
Yeah, so I think some of the challenges that we have specifically to the COVID-19 is access to for our older adults getting into the clinics. Some clinics are closed and they don't see their patients, or medical groups aren't seeing their patients. We don't want them going to the ER if at all possible. I mean, that's a huge exposure potential. And so I think that we as advanced practice nurses need to be a little more savvy, both proactively and in our day-to-day interactions, whether that's virtually or we do get to see our clients coming into the office, that we need to be a little more attuned to their psychological well-being and the needs around mental health, whether that's an individual that's got that has a diagnosis or has a condition, as well as even the worried well are being potentiated with issues in this crisis as well. And what I often tell worried well, whether they're older or young, stop watching the news. Get your information from reliable sources. Make sure that you're asking yourself, me sitting here in front of this TV watching this desperation in news, is that helping me or hurting me? And we know that with resilience, that's an important question that people who have demonstrated resilience and coping ability is an important question they ask themselves. If I stay in this situation, like watching the news, is this helping or hurting me? And people who are resilient will make the decision that they limit their time on the news and find other outlets and other ways of getting that information that's more healthier, less anxiety provoking. I mean, even for me, watching the news is I get scared. I get more scared every time I watch the news.
Yes.
And so I've really started trying to just rely on some updates with COVID-19 through my Florida Nurses Association, through other associations, versus really trying to get that information from the news, because the news is really exacerbating. I don't know if that's the right word, but they're overblowing. I think it's important that they be doing what they're doing. I think we need to know the severity of this illness. But I think as a consumer, especially an older adult consumer who's isolated in their home, hearing that can just cause so much other issues around emotional distress and anxiety and further depression. That, if you're resilient, you're going to kind of prevent yourself from doing that and finding other outlets.
Oh, I love that.
I think we as nurse practitioners can teach our patients that. And I think
Yeah.
that this is I don't know if a wake-up call, because that's so contrite, but this is an opportunity for us, as I think as advanced practice nurses, to understand that in our primary care settings, whether that's home or long-term care or nursing homes, that we need to go back to the basics of physical health and mental health well-being are both important, and you can't dissect one from the other. And we must be more proactive in helping our patients understand that, our clients or residents, and be able to guide them into understanding how their well-being impacts their physical health and vice versa, and give them strategies and work out some strategies with them to help them be more engaged in their communities, to be more active in their civic duties, to be more active in senior citizens. My hope after this is we'll have more senior citizens, senior centers open so that people can be more engaged. Maybe this is kind of that, again, wake-up call for us as primary care providers to really help them navigate all these these social psych needs that we all need to be healthy and live a happy and full life.
That's really great, George. One of the things you're making me think about is the social isolation that we talk about with seniors, that not just rural dwelling seniors, but seniors in all kinds of settings. And you're kind of saying, here's an opportunity for us as practitioners to be able to maybe have that conversation about social isolation with
Right,
our
right,
elders and why it's
right,
important to be
right.
connected.
And I think for us, one of the things I'm struggling with recently is this, there are those who are of all ages, but since I work with older adults, who self-select to be isolative. That's their personality, that's their want. But this pandemic has really made that coping ability more challenging for us to help meet their needs while still honoring that isolation. You know, there's some really good research around loneliness and its impact on health. It's like it has health outcomes related, it's equal to or related to smoking, high blood pressure. And that's the loneliness that's not self-selected. That's the loneliness that one finds themselves in at the end of life that does detriment their health. There is a self-select loneliness, but again, that's even more that's more challenging to manage in a clinic because the person, first of all, they haven't had those social connections. They haven't, that's not what they want. That's not what they've done. So they've even, not only have they isolated themselves from that social connection, but they've isolated themselves from everything. And so helping them to get their needs met while also still honoring that, I think to me, in practice, in my primary care practice, has been the biggest challenge. Not only with the pandemic, but just in general, to kind of keep that mental health and the brain active while one is also choosing to be isolative. You know, we could have a whole different talk, conversation around that, and you know, that
Yeah.
self-selected loneliness versus or isolation versus true loneliness that comes with the multiple losses and where an individual ends up in life. And I would love to have that conversation with you at another time.
No, that's so true. You know, can you tell us a little bit about what you're experiencing, or if you're experiencing taking care of patients in that long-term care environment right now, George, and how you know, you're dealing with their mental health care needs? Are separated from family.
Yeah. So I work with Optum Care, and I do skilled nursing visits. I work per diem, so I don't really see the whole gamut, but my experience has been is everyone is attempting in the nursing homes to keep things as normal as possible, keeping patients engaged within the facility, giving them activities, finding some activities that may keep them at social distance, but being able to still be engaged. And then we know we have healthcare workers who, you know, we don't pay our CNAs very well, even our LPNs. They have to work. They're stressed out. They have concerns about their health and well-being and their family, and they're still coming. And so you just feel that when you walk into facilities. It's just so much. It's like a burden. It's a really heavy burden. And just really what I find as an individual who can come in as per diem and walk in is I just can sit down and just talk. And I find that has helped in my regular practice before this pandemic, but I think it even helps more because the staff are thin. You know, they're understaffed right now. They have people calling out. They want to provide the best care they can, and they are, but they're not having necessarily that personal one-on-one time beyond that day-to-day ADL care and beyond that, but really just sitting down and listening. And I've heard great stories about other pandemics. I've heard great stories about how this, you know, about war and how to ration, you know, how they've rationed. All those stories just seem to be more powerful now. And you can tell that it kind of relieves that older person to be able to just tell that story, to be able to share their insights, because I think many of them feel helpless. They're in an environment that they have no control. They already feel helpless. And now this added pandemic has occurred, and they even have more anxiety, more isolation as well. I was just, the reason I was hesitant there, I was thinking about, I also go onto a locked unit, and I don't really feel that things are really that different on locked units in terms of the staff have really worked hard to just kind of keep things the way they've always kept it. I do think that, you know, the challenges around wearing PPE and all those things in a locked ward are there. And just, I think the key has been to normalize it as much as possible. But it is a challenge to wear the PPE in a locked ward, especially, I found.
Yes, yeah, that's it. And how do persons with dementia interpret that?
Yeah,
You know,
exactly.
that's that's a huge challenge.
And keeping that social distance is also hugely challenged.
Yes, yeah, yeah. And of course, what we're also seeing is we're seeing people remove their loved ones from their long-term care. So now we've got a situational change in environment that I'm not sure all family members understand that individual may go through when they're moved.
And I think that might be a right choice for some patients. You know, just really, I guess context matters in that situation. You know, where are they the most safest at? I think right now in Florida, some of the nursing homes are the most safest place because we implemented really early on evaluations prior to going into the building, limiting all providers and external individuals from entering the building. Family, there's no visiting unless it's a custodial end of life kind of care. And then that's very limited in very specific rooms and places. So I think that it might, you know, you have to weigh that versus going home and the potential exposure. Now, but I could see a decision being made that it's better for me to take them home, right? And then that opens up the other questions. Well, why aren't they home now anyway? But but you know, we all have all our lives have been upheaved, and you know, many of us are like myself, and we are at home. That's what we do. That's our life today, is being at home. I teach from home. I go out once a week to the nursing home, but I'm basically at home. And so, you know, we can make different choices when we're in that situation.
Yes, yeah. And that you're making a great point about the family support or caregiver or significant others that are distant, you know, from their loved one during this time, and how they're feeling and the anxiety that they have about that.
Right. And I think that, you know, for us as nurse practitioners, not only in the nursing home, but specifically in long-term care, even community care, is to make sure that we are intentionally looking for connections for that patient and their families if they're isolated from others. Because, you know, here in Florida, we have a lot of isolation from mom and dad's down here, or mom's down here, and the family are up north, or you know, some far away place where they can't necessarily come very often. So how do we help that patient or that person create connections to their neighbor, especially when we're talking about the one who wants to self-isolate? That's the perfect person to kind of connect them with, is the neighbor. Can we get them, one neighbor or the other, to kind of just check in on them and kind of work with them around that? But yeah, I think that forced isolation around, you know, just not having that social support. And I'd also say, even in that 10 to 15% that I think we need to pay attention to, is there's a lot of food insecurity with that group. There's a lot of economic uncertainty with that group. That we have to pay attention to and help them find ways. So I wanted to make sure that I shared, before I get off here, a couple of resources. So if you don't mind, this would be a good time for me to say that.
That would be great. That'd be great.
So one is 211. It's important to let our older adults know about dialing 211, and that's about getting connected to social services. And then there's the new 988, which is the suicide crisis. Even if you're not in suicide, I mean, it was intentionally made for suicide, you can call in crisis, and they can help connect you to resources like Meals on Wheels, social services, things that like that, getting their medications if they're not able to get their medications, etc. And then there's a new crisis. I don't know if it's new to me, so I don't know if it's new, but it's 741-741. And it's a crisis texting now that everybody texts us now. So those are three, I think, very important resources we should give our patients, our residents and clients when we see them in primary care, especially during this pandemic.
No, those are great. That's great, George.
Thank you.
I really appreciate you sharing that. I guess as we wrap things up, I'll segue a little bit and ask you about the nurse practitioner taking care of themselves as they're being a care provider during this crisis.
So to me, I think for all of us, it's keeping our routine, making a routine and sticking to it. Even for us nurse practitioners who maybe still go to practice in clinic, we still have to come home, keep the routine the way it is as much as you possibly can. I think this is a great opportunity for us to self-reflect and look at our own health, both physical and well-being, and maybe looking at, what is our exercise routines? Where can we improve our exercise? How can we eat better? How can we have, this is a great time for those of us who have to stay home, this is a great time to practice meditation, yoga, Tai Chi, those things that we want our patients to do. This is an opportunity for us to learn just how effective those kinds of things can be. But I think I'm a Watsonian by my theoretical framework, and it's all about caring for yourself in order to care for others. And as carers, we care not only for ourselves and our families, we care for our patients. You have to care for yourself in order to be able to be available to care for those others. So you got to take time for yourself. Plenty of food, rest, good nutrition, all these things we teach our patients. It's time for us to really start practicing so that we can maintain our health in order to help others.
Those are great tips, George, and I know that our members really appreciate hearing them, and you can't hear them enough. And it's a really stressful time.
It is.
And I love the way you talked about kind of filling ourselves up so that we can be a resource to others, because I think we tend to kind of empty ourselves out every clinical day.
I agree.
Yeah.
You got to 8 hours of rest. You got to get that rest. All those things that are important to well-being.
Yeah. No, I love that. That's wonderful. Well, I'm going to end our time now.
Okay.
Can't keep you all day.